September is Vascular Awareness Month. Although vascular diseases affect up to 40 to 50% of the population, many of these diseases are not well known by most people. Here to tell us more is Rebecca Van Zanen from the Corewell Health Vascular Surgery and Vein Center. Good morning, Rebecca. Thanks for being with us.
Good morning. Thank you so much for having me.
Absolutely. So talk to us first. What is vascular disease?
Yeah, vascular disease can encompass many different factors, but ultimately it covers the circulatory system. So it can include disorders of the arteries, the veins, the lymphatic system, and also blood disorders that affect clotting or bleeding.
Okay. So are there ways to prevent vascular disease?
Yeah, it's a great question. Vascular disease, we tend to break up into three categories: venous, arterial, and lymphatic. In both cases, tobacco use significantly affects vascular health. And so avoiding tobacco is key in maintaining and preventing vascular disease. Exercise is also important both for venous and arterial disease. In the case of arterial disease, however, there's additional factors such as high blood pressure, high cholesterol, diabetes, and kidney disease. So working with your doctor and including diet and exercise to optimize those conditions is very helpful.
Okay, so definitely some lifestyle things that can impact this.
Absolutely.
Talk to us a little bit about the differences, though, between artery disease and vein disease, specifically in the legs, because I think that's where we see a lot of that, right?
Absolutely. Yeah, that's probably the most visible. For venous disease, people will potentially see either spider veins or bulging veins, those varicose veins that sometimes stick out of the skin. They can experience aching or heaviness of their legs, particularly with prolonged episodes of standing or sitting, often relieved with elevation. You may experience discoloration of the lower legs, particularly around the ankles, swelling, or even wounds at the ankles, as opposed to arterial disease, where the legs can be shiny, cold, lack hair. You may experience pain in your legs or cramping or fatigue with exercise specifically that improves when you rest. And in severe cases, people can experience constant pain in their lower legs and feet, or wounds on their toes or lower legs that occur simply because there's not enough blood flow down to the legs.
Okay, so you talk about moving and exercise and how that can be a little bit of a preventative care, but you're talking about pain as well. So what are things that we can do to prevent getting varicose and spider veins, that will fit into our lifestyle?
Absolutely. So with venous disease specifically, certainly people will experience pain. However, in veins, it's primarily when you've been standing or sitting for a long time. So walking or exercising as much as you can is helpful and can actually relieve that pain. The other important things specifically for spider veins is good use of sunscreen. Sun exposure can cause worsening of spider veins. And then also using compression stockings. There are many different kinds of compression, but using compression to help alleviate the pressure of gravity and give some support to those veins is very important as well.
Okay, wonderful. And you say like 40 to 50% of people suffer from this. You guys are offering free screenings for the month of September. How can our viewers learn more?
Absolutely. So our screenings can be accessed via a MyChart account. So for patients who are part of the Corewell Health System, they can log on to their MyChart, or they can call our number at 616-391-VASC to order a free screening.
Perfect. Rebecca, thank you so much for your time. We really appreciate it.
Absolutely. Have a nice day.
You too. We'll be right back.